So are you ready to do a pain management program? Many patients have often asked me whether they can do a pain management program, and then when they actually find out what is involved, they drop out. This is a big challenge, and so in this video I'm going to be exploring a little bit more about what you need to know and what your healthcare professional needs to know before embarking on a pain management program, and more importantly, is that the right thing for you? Welcome back to this channel. And in the previous video I talked about pain management programs and what you need to know about them in general, as they are offered here in the United Kingdom for patients with chronic pain in the secondary care or in the intermediate care setting. But what is the readiness for a pain management program, and do you think you're there? Now, this is something very difficult for most of us to know, and often very difficult for you to also understand whether you're there as yet. But luckily, there are some rules of thumb, and certainly I'm going to introduce one such way wherein you can decide if you think you're there and you're ready to do a pain management program. I look upon this as the work that was done, the behavior change cycle, which was introduced by a couple of psychology professors from the US called Prochaska and De Clemente back in the early 1990s. Now, their work, they've been able to look and see when people are ready to change behavior, and that's what essentially a pain management program is about. It's about readiness to change your behavior and the response to pain. And they decided, and they talked about it from a health perspective, not just in chronic pain, but broadly for long-term condition management. They had divided it into 6 phases. So phase 1 is pre-contemplation, phase 2 is contemplation, phase 3 is preparation, phase 4 is action, phase 5 is maintenance, and phase 6 is relapse. And they felt that anybody wanting to change behaviors would necessarily cycle through these 6 phases, and that's important to understand. So how does that translate into readiness for a pain management program? Now, in the first phase, which is pre-contemplation, people may not be even aware that they have a problem. So if you are in a situation where you have chronic pain, but you are very much of the consideration that there is a structural focus, that there must be a medicine that can fix this, or an injection or a surgery that can take it away, then that means that you're not even aware of what a pain management program might do. And that would be in some ways indicative to you and to your healthcare professional, especially, that you're not going to be in the right frame for a pain management program. You're not ready for a PMP. And at this point, if I were to find patients who come to see me and say, can I do a pain management program? And I find that they are in the pre-contemplative phase, I'm going to be telling them that here are a lot of resources to understand about your pain. But if they are looking at the medications or interventions or surgery, then that's something that they may need to try before coming down the program route. Next, we go on to phase 2, which is the contemplative phase. And in this phase, patients often realize that they want to do something about it, but they're not sure what. They're not sure whether a pain management program is the right thing for them, because they're still hoping that the surgery they're waiting for, or the injection that they're going to have next week, or maybe a new drug that's going to be started, will be the change that they need. This is again a place wherein a PMP is not the right option for you. And it might be that your healthcare professional is going to give you more resources to look at, maybe something for you to read about, to understand other techniques of managing the pain while you wait for your injection or your tablet to work or see. The third phase is the preparation phase. This is the phase where you realize that while medication surgeries might help, you're looking for a sustainable way. You're looking for a way to understand your body, to learn the skills that you need to look after and manage your pain, You've got the time, because a pain management program is often an intensive approach. It's a weekly, sometimes fortnightly, for 6 to 12 weeks. So you need to make the time for that 2 to 3 months, to give the time for you to learn the skills and have the time to repeatedly practice them. And you're ready to do it, because in phase 3, in the preparation phase, you realize that your existing way of being is not going to work, and you're ready and you want to do something. This is the ideal phase where I think somebody is ready for the PMP, what's required and what's taken in, and that is the place for you to do a PMP. Phase 4 is again the action. You've already started doing some ways to look after yourself, and you just need more help, more accountability, more support, maybe from others around you or a therapist. That is again an ideal place to be doing a PMP. And I think for people in phase 3 and 4, the PMP is the best place to do it. Phase 5 is maintenance. Maintenance means you've already learned the skills. You sometimes just need a little bit of a top up, a little bit of a practice there. You could certainly benefit from a PMP, but it might be that a top up or an online option of a refresher session is better for you rather than doing a whole 12 weeks. And this is something that you need to be able to decide. And so a PMP would be useful, but a refresher session would be the most ideal one for you to look at in terms of when you're in phase 5. The phase 6 is what's called the relapse section. Now, this is something that every one of us as humans, we are going to fall off the wagon sometimes. And at that point of time, you just need someone to sort of pick you up, dust you off, and get you back onto the preparation or action phase. It's something that we just need to look at as a setback rather than a failure. And that's important. Setbacks are common when you're learning a new skill. And this is again a phase where someone would very much benefit from a full PMP, maybe a refresher depending on how motivated you are. But a PMP would be again an ideal place for you to just get back on the cycle, get the support from the therapist, from the group that you're with, and that is a big difference. I find this quite useful, and I hope you also found this sort of helping you know which of the 6 phases you're in terms of behavior change, and to see whether you're ready for a PMP. Thank you for watching this video. I hope you found it useful, and I'll see you again in the next video. Thank you for watching the videos. I hope you're getting value from them. Don't forget to subscribe and hit the bell button for notifications on when the next videos are to be released.